I'm Dr. David Hill, and today we're going to be talking about how to treat oral thrush in newborns. Now, what is thrush? You'll see thrush as white patches. Sometimes they're kind of filmy looking, and they may appear on the tongue, on the inside of the cheeks, on the gums. What thrush is actually a yeast infection with a yeast called Candida albicans. Now, Candida yeast live on our bodies from shortly after birth. They're a normal part of that whole busload of organisms that rides around on us. They help us, we help them. Usually they're not causing a problem. But the newborn's immune system is not very good at handling organisms like Candida. So occasionally newborns will get an overgrowth of Candida inside their mouths. Sometimes it's also associated with a diaper rash, which may be another place where the same infection is occurring. How do you know that it's a thrush infection and not just some milk or formula that's left on the inside of the baby's mouth? Well, you can take a little wash rag, or in our office we use a tongue depressor, and just see if it scrapes off. The white patches from yeast do not scrape off. So if you can clean it off with a finger or a washcloth, that's not thrush. Now, why do we care if a baby gets thrush? Well, thrush can be uncomfortable. So when it occurs, some babies stop eating very well, and of course that's a significant problem. So when we find thrush, we usually do try to treat it. What can we do? We use a medicine for the most part called nystatin. This is sort of a yellowish thick liquid that you can actually dab onto the inside of the mouth. We usually apply the nystatin about 30 minutes before a feed, and you really want to dribble it right onto the thrush as best you can. It should come with a little medicine dropper. In some cases, when the thrush is bad, you can even take a cotton swab like a Q-tip, dip it in the medicine, and apply the medicine directly to the parts of the mouth where it's the worst. People ask, do I need to boil my nipples if my baby has thrush? And that is artificial nipples for bottles or pacifiers. If you're breastfeeding, we're going to talk about that in just a second. But if you're using artificial nipples, you don't need to boil them. A good hot dishwasher cycle should be absolutely fine. However, you may want to make sure that you're using a silicone nipple. You may want to try a different, gentler seeming nipple than what you're using. If your baby uses a pacifier, you really want to minimize that. Pacifiers can make the thrush a bit worse. They can be a little traumatic to the inside of the mouth. So you really want to hold off on the pacifier use, except for those times when you really need it the very most. You also want to go with the smallest possible pacifier so that it's a little less traumatic. Now, what if you're a nursing mother? Well, that same yeast infection can get on the nursing mother's breasts and cause a really painful condition called mastitis. So if you're getting some redness or pain, or it just feels like it should not hurt this much, and especially if your baby also has thrush, you probably want to talk to your doctor about providing a form of nystatin that you can apply directly to the nipple to get that thrush to go away. So talking about how we treat thrush in your newborn, I'm Dr. David Hill.